From time to time as a nurse, you will encounter patients with behaviors that you find difficult. It's important to be able to recognize why these patients are difficult and how to develop and implement proper strategies to deal with these difficult patients so that you can achieve the best outcome for both you and the patients. Hello everyone, this is the Nice Nurse Cares with your popular nurse, Nurse Esther. This channel is about everything nursing. If this is the type of content that interests you, please consider subscribing and click the notification bell so that you'll be the first to be informed when I release a new video. Now, without wasting much time, let's roll. As a nurse, you will always come across patients or their relations who are angry. Best thing you can do is to listen. Pay attention as they voice out their anger. Pay attention. Listen very well. Acknowledge what they are saying. Yes. Empathize with them. You can say, I understand why you are angry. Apologize. Do not try to claim right. Watch your body language as you listen. Maintain eye contact. Be calm when speaking. Watch your tone of voice. Be empathetic. Put yourself in the patient's shoes. Apologize. Listen very well and ask questions so that you can understand the issue and know how to solve it. When the patient is really angry, what should you do? It is important that you allow patient to vent their anger for you to acknowledge, I can say you are really very angry about this. Or you could say, this is a very frustrating situation you are in. In addition, keep calm. Watch your tone of voice. Use a neutral tone. Keep your tone of voice down. Call the patient by name. Avoid becoming defensive or taking comments personally. Don't speak offense. Seek to de-escalate the situation. Don't do things that will escalate it. When a patient is violent, what should you do as a nurse? Your safety and the safety of all those around you is important. When confronted by a violent patient, to diffuse the violence, remain calm, reassure, and acknowledge any grievances. Provide the patient with an opportunity to explain. Maintain eye contact. Keep a safe distance. Your safety and the safety of those around you is very important. Position yourself between the patient and the exit. If you are feeling unsafe, leave the room and get help. Do not allow yourself to fall victim of assault. Take your leave. If you feel threatened and you feel you are no longer safe, take your leave. Get help. Some patients can be manipulative. What that means is that they can set you up and tell you that if you do not give them a particular drug, they are going to report you. If you are being manipulated by a patient, remain firm. Do not compromise your standards. Try to help the patient within appropriate boundaries. Do not overstep your boundary. Realize that sometimes you need to say no and mean it. Seek help from a colleague or refer patient when a patient's family is proving difficult. What you do is that you carry them along. Talk to them. Communication is essential in this regard. But remember, you have to be confidential. Seek permission from patient before you can divulge sensitive information to friends or relatives. These days, there have been a lot of cases of assaults on healthcare workers. Sometimes it is not the fault of the healthcare provider. It is the fault of the system or the society in general. Everywhere is tense, people are becoming angrier, and things are becoming more difficult. Do not cave in because of pressure or stress. If you feel that you cannot handle a difficult patient and their family, let another of your colleagues that is familiar with them take over. Accept that some nurse-patient relationship cannot continue. When the patient is verbally abusive or angry, document the incident. When you are doing the documentation, be open-minded. Managing difficult patients and their families can be very stressful. Take care of yourself and your relationship so that you will always be at your best when caring for others. Reflect on what you have learned. to help you in similar interactions in the future. Administer patient satisfaction survey. Determine the cause of the patient's anger and implement these techniques to improve care. Don't ignore the problem and don't stop communicating. Thank you very much for watching. See you in my next video. Do not forget to like, share and comment. Thanks for watching.